Mia was excited about becoming a big kid, but when her body started growing way faster than her friends, she wasn't so sure. Her parents noticed the rapid changes too and consulted with her pediatrician. Could Mia really be going through puberty at such a young age? They wondered and researched. What could they do to help her? That's when Mia and her family were referred to Dr. Baker, a pediatric endocrinologist. They learned Dr. Baker specialized in the diagnosis and treatment of children with diseases related to the endocrine system, such as growth disorders. He helps kids like Mia every day. When it was time for her visit, Dr. Baker performed a series of blood tests, measured Mia's height and growth, and ordered an X-ray of her wrist to determine how fast her bones were growing. After analyzing all the results, he diagnosed Mia with central precocious puberty, or CPP. Dr. Baker explained CPP is the early onset of puberty that occurs earlier than age 8 in girls and age 9 in boys. Although its cause is often unknown, 1 in 5,000 to 10,000 children may be diagnosed with CPP. Some of them had even been treated by Dr. Baker. So, what exactly was happening with Mia's body? With CPP, parts of the brain produce hormones that cause increased levels of the sex hormones estradiol and testosterone at an earlier than normal age. This was leading her to start puberty early and exhibit symptoms like sexual development and an increase in growth. Mia's family was relieved to hear various treatment options are available and that treatment may be stopped when Mia is at a normal age to begin puberty. One treatment option is SUPPRELIN LA, a small, flexible implant 3.5 centimeters by 3 millimeters, inserted under the skin in the upper area of the non-dominant arm. For example, since Mia is right-handed, the implant would normally be inserted in her left arm. Some doctors, like Dr. Baker, would refer Mia to another doctor to have the implant procedure done. Once implanted, SUPPRELIN LA releases a medicine called histrelin acetate continuously each and every day. This medicine reduces the sex hormone levels and may stop CPP after the first month of treatment. One SUPPRELIN LA implant works for a full 12 months, at which time it should be removed and replaced with a new implant if appropriate. Mia's family understands it's very important to keep all of her appointments with Dr. Baker so that her treatment can be monitored. With a better understanding of CPP and the treatment options available, they can rest easier knowing that there are treatment options for Mia. For more information about SUPPRELIN LA, sign up to receive a free educational caregiver kit and watch videos about CPP at www.freecppkit.com. The kits are available in English and Spanish and contain educational materials for the whole family, including a demonstration implant and an illustrated book to help children understand more about CPP.
What is SUPPRELIN LA? SUPPRELIN LA is an implanted gonadotropin-releasing hormone, GnRH, medicine used for the treatment of children with central precocious puberty, CPP. It is not known if SUPPRELIN LA is safe and effective in children under 2 years of age. Important safety information about SUPPRELIN LA. SUPPRELIN LA should not be taken if your child is allergic to gonadotropin-releasing hormone, GnRH. GnRH agonist medicines, or any ingredients in the SUPPRELIN LA implant, or is pregnant or becomes pregnant. SUPPRELIN LA can cause birth defects or loss of the baby. If your child becomes pregnant, call your doctor. In the first week of treatment, SUPPRELIN LA can cause an increase in some hormones. During this time, you may notice more signs of puberty in your child, including light vaginal bleeding and breast enlargement in girls. Within 4 weeks of treatment, you should see signs in your child that puberty is stopping. Some people have had implant breakage during the removal process. Some people who had SUPPRELIN LA placed in their arm have had the implant come through the skin, Extrusion. Call your child's doctor right away if the SUPPRELIN LA implant comes through the skin. Some people taking GnRH agonists like SUPPRELIN LA have had new or worsening mental, psychiatric problems, including depression. Mental, psychiatric problems may include emotional symptoms such as crying, irritability, restlessness, impatience, anger, and acting aggressive. Before your child receives SUPPRELIN LA, tell the doctor if they have a history of mental problems. Call your child's doctor right away if your child has any new or worsening mental symptoms or problems while taking SUPPRELIN LA. Some people taking GnRH agonists like SUPPRELIN LA have had seizures. The risk of seizures may be higher in people who have a history of seizures, epilepsy, brain or brain vessel, cerebrovascular problems or tumors, or who are taking a medicine that has been connected to seizures such as bupropion or selective serotonin reuptake inhibitors, SSRIs. Seizures have also happened in people who have not had any of these problems. Before your child receives SUPPRELIN LA, tell the doctor if they have a history of these problems, as well as all the medicines they take. Call your child's doctor right away if your child has a seizure while taking SUPPRELIN LA. Severe cutaneous skin adverse reactions can happen during treatment with GnRH agonists like SUPPRELIN LA. Stop SUPPRELIN LA and call your child's doctor right away if your child has any of the following signs or symptoms during treatment with SUPPRELIN LA: skin rash or acne, blisters or sores in the mouth, dry skin, peeling of the skin, itching, fever, blisters on the skin, muscle or joint aches, redness or swelling of the face, hands, or soles of the feet, and/or swollen glands. Increased pressure in the fluid around the brain can happen in children taking GnRH agonist medicines, including SUPPRELIN LA. Call your child's doctor right away if your child has any of the following symptoms during treatment with SUPPRELIN LA: headache, eye problems, including blurred vision, double vision, and decreased eyesight, eye pain, ringing in the ears, dizziness, nausea. Your child's doctor should do tests to make sure your child has CPP before treating with SUPPRELIN LA. SUPPRELIN LA lasts for 12 months. One implant will give the medicine for 12 months. After 12 months, SUPPRELIN LA must be removed. The doctor may insert a new SUPPRELIN LA at this time to continue treatment. SUPPRELIN LA is placed under the skin of the inside of the upper arm. The doctor will numb the arm of your child, make a small cut, and then place SUPPRELIN LA under the skin. The cut may be closed with stitches or surgical strips and covered with a pressure bandage. Your child should keep the arm clean and dry and should not swim or bathe for 24 hours after receiving the SUPPRELIN LA implant. The bandage can be removed after 24 hours. Do not remove any surgical strips. They will fall off on their own in a few days. Your child should avoid heavy play or exercise that uses the implanted arm for 7 days. You and your child should routinely check the insertion site until the cut is healed. After the cut has healed, your child can go back to his or her normal activities. The doctor will give you complete instructions. Keep all scheduled visits to the doctor. Your child's doctor will do regular exams and blood tests to check for signs of puberty. Sometimes the doctor will have to do special tests, such as ultrasound or MRI, if the SUPPRELIN LA implant is difficult to find under your child's skin. The most common side effects of SUPPRELIN LA are skin reactions at the place where the implant is inserted. These reactions may include pain, redness, bruising, soreness, and swelling in and around the implant site. Call your child's doctor if your child has bleeding, redness, or severe pain where the implant was inserted. You are encouraged to report negative side effects of prescription drugs to the FDA. Visit MedWatch or call 1-800-FDA-1088. Please see full prescribing information, including medication guide.